think absolutely the goal is enhanced functionality, because like we just said, it's not always possible, depending on the etiology of the patient's pain, to eliminate it completely. That's not realistic. But if we ask the patient those questions and really look at them as a partner in pain management, we can come up with a strategy to set realistic pain goals and strategies to enhance their quality of life and their functional status, that in a way that's satisfactory to the patient, that they can go about their daily life and accomplish some of those things that they were doing before, without saying, we're gonna treat your pain so well you're gonna go out and run a marathon next week. You're 80 years old. That's probably not gonna happen anymore, but we will do our best to get you to a place that is, better than where you are now.
This conversation reminds me of a patient I've taken care of for years. He's a tall drink of water, a 6'8" man who was a construction worker, and a concrete ceiling fell on him and obliterated his right hip. So he has more hardware in his right hip than the bionic man. And when he came to me, because I work in the primary care practice where he was followed by his physician, his pain was an 8 on average, and it was just horrible. It kept him from doing most of his activities of daily living. And I said, Mr. Smith, I'm going to keep swinging. We're going to try every drug in the universe with any hint of analgesic effect. And I remember clearly a year later, we had tried every drug in the book, and it frankly was not a whole lot better. And I said, Mr. Smith, I feel like a failure. You came to me, the pain was an 8. You told me today the pain is still an 8. And he said, but it's a better 8. I said, you're trying to cheer me up. He said, no, I don't want to kill myself anymore. It's still an 8, but I'm coping better with the pain. So I think getting away from focusing on that number is an important part of it.